Hello, and welcome back to the Derm Club podcast, where we explore the latest trends, breakthroughs, and insights into the world of clinical dermatology and the industry. Today, I am thrilled to have Dr. Sherling, a dermatologist in South Florida and the co founder of Modernizing Medicine, a platform that has helped to transform and digitize dermatology practices across the United States. We're going to spend a lot of time today discussing Modernizing Medicine, a company that was founded back in 2010. Modernizing Medicine, for those of you who don't know, is an electronic medical record, EMR for short. It's a system that is designed for specialty fields like dermatology. I myself have spent a great deal of time using their platform while seeing dermatology patients in the clinic. And the truth is, it has created unparalleled efficiency, bridging technology and healthcare to bring dermatology and practices together, as well as patients into the digital age. Throughout our discussion, we'll delve into the heart of modernizing medicine, exploring its impact on the field of dermatology and its unique edge in the competitive landscape of EMRs. We'll discuss the role of artificial intelligence in shaping the future of EMR and how modernizing medicine plans to integrate these advancements. So, without further ado, let's get started. Welcome, Dr. Sherling. It's truly a pleasure to have you on the Derm Club podcast.
Thank you so much. I really appreciate the opportunity. I'm looking forward to spending some time with you and sharing with you our vision for how we can improve the lives of our customers.
Wonderful. So, we'll get started by first asking, could you share what was the foundation of modernizing medicine? What was your inspiration and the mission that has led to this wonderful creation?
Thank you for asking. When it was actually started back probably in medical school, actually when I was learning, obviously anatomy and physiology and all sorts of things. There was a class that was taught in the business school how to start a high-tech company. And I audited it. And so like during medical school, I'm like, you know, learning about medicine. So I basically snuck out into the business school, took this class, and
Sounds a
to
lot
sort
more
of
fun than anatomy.
like how to learn about how to start a business plan and all these other things. So I was like, wow, this is really kind of cool. And so that kind of got me thinking about like doing a joint MD MBA program, which I did, which was also kind of interesting and has its own set of challenges because as a physician, in training, not really having the business background, I couldn't really contribute to those discussions in class on business school, but definitely helped me figure out what I kind of wanted to do the next step. After that, I went to residency, did a dermatology residency, relocated to Florida, was in private practice there for about a year. And then just a chance encounter with a patient happened where a patient came to my clinic. That was my co-founder, just coming in for a routine skin check. I had learned during the encounter that he founded a company called Blackboard. It's an e-learning company that he took public for $1.6 billion on the NASDAQ, I guess while I was in residency, and was kind of in between his next opportunity. And so I pitched him this idea about how do we save physicians time? How do we build an electronic medical record that's workflow friendly? And at the time he gets pitched all the time about people wanting to start companies with him. And all of his co-founders were strangely named Michaels. So I was just the third Michael, like in his
Should I change my name?
line of Michaels. Yeah. So I guess so randomly it worked. We went out to his favorite restaurant and I pitched him, this idea of how do we make a technology that helps physicians. And I drew the user interface that we have, which is the virtual exam room on a napkin, and said, hey, can we do this? And this was before the invention of the iPad. And so it was kind of cool timing. As with everything in life, timing is everything. So he agreed. We decided to start the company together, and he taught me how to code. And so I learned how to code XML and JavaScript. And I was initially going to try to teach him dermatology, but that didn't work out. So he's like, you build dermatology, I'll build the platform. And I was like, better idea. And so we did that. We built the product in about, I want to say 6 to 9 months or so. And then we started kind of, iterating, and just like as with anything in any entrepreneurial venture, like you have to really know your customer. And here I was the customer, so I brought that prototype inside my practice and tweaked it. And things I thought would work didn't work at all. And things that like I thought weren't as big of a deal were actually critical to making the product work. And we take that kind of as the secret sauce today for everything that we do.
Wow. Well, it sounds like you're a jack of all trades.
Yeah, it was definitely, looking back on it, it was kind of crazy. Because I was in clinic like, 4 days a week then. And then people would say to me, have fun on your day off. My office manager would say, have fun on your day off. I'm like, I'm building a company on my day off, and from 9 p.m. to 2 a.m. every day. So it was just kind of like, yeah, I would like tuck in my son, and then like, then start coding like literally for like 2 or 3 years. And then that's really this how much grit it takes to build something that works. So
Well, it's amazing
yeah.
because it certainly works and it's so highly used. And I think you've done such an incredible job. And partially that's obviously because of your expertise, your co-founder, but also because you were in the space of dermatology. So you knew exactly what the need was, what the demand was, and what could be used to make it better. So was dermatology the specialty, I'm assuming, where it started, and then you started to go to into other specialties from there?
Yeah, exactly. So as a dermatologist, that was the natural starting point. But then as we kind of had success in dermatology, we thought about, like, what are the other specialties that we can go into that kind of have a similar challenge where there's a high volume of patients, it's more of a visual interaction. They don't have the time to take 10 minutes to write a note. And so from there, I learned a lesson like, hey, I'm not going to teach Dan dermatology, nor am I going to be an ophthalmologist or orthopedic surgeon. I'm going to hire that person, teach them how to code, and then give them the tools they need to make it a success in their practice. And that's
Mm,
really been the model. And we're in about 11 specialties today. And so a lot of
wow.
them are surgical subspecialties, kind of with that same kind of mix of visual, iPad interface, medical knowledge baked in. And so we're in derm, opth, ortho, ENT, uro, OBGYN, plastics, pain, among others. We're also in gastroenterology as well. So a lot of different options.
So, would you say that I know I've used it in private practice, but would you say that primarily that is where this kind of works? Or
Yeah.
could you see potential for this also working, say, in an emergency room, like where a patient comes in and you want to triage them, you hand them a tablet and they could
Yeah.
start filling out their chart and then you can do the rest in the EMR system?
I think it has potential to really work in any specialty. I think a part of like being an entrepreneur is like, where do I put all my energy to make sure it's successful? And the fewer specialties you do, the more focus you have, the more the ability that you have to deliver that workflow that each doctor really wants for their specialty, so that we're not trying to be everything to everyone, but really just execute on like one specialty at a time. And so
Right.
that's really been our MO has been, let's not take on too much, let's focus, and let's try to deliver everything we can to the specialties we serve. But as
Be
we've
the
gotten
best you can
success,
be.
exactly. As
Yeah.
we've gotten success, it's been hard to escape, because as I go see doctors, like they know who I am. And so like I went to the optometrist and they were using our product, and I was like, no, click here, do that. And then like, oh, here, like he's here, like let's go ask him some questions. So it's definitely a little bit hard to escape now, but it's nice to see other practices using it, and especially in different specialties. It's kind of cool. So it's been fun.
How quickly did you transition from one specialty into the next?
We started dermatology, I want to say it's 2010, and then really, started building ophthalmology about a couple years later. It does take a couple years to kind of build a vertical, and then use that vertical in practice and kind of tweak it. So I would say it's probably a 2-year process to build a specialty. And so
Mm.
we would space those out every couple years or so.
And then, not to get into the nitty-gritty, but I'm assuming first you implemented your product in your own practice or wherever you were working. And
Mhm.
then was it difficult to start Like, what was your approach to get other practices to use it after that point?
Yeah, I mean, it was, I think the first thing, I think Dan is my co-founder. He's the CEO. And we were started building it like almost theoretically. And I think I could tell that Dan was getting frustrated with me because he was like, I don't want to listen to what you have to say until you yourself become the customer and start using it. And then I did. And then I realized like half the things that I wanted really weren't critical and the other half really were. And I think at that point, I got buy-in. And that was a good lesson for me as we hire physicians, is to make sure they're using it too, to make sure that we have its credibility. It's, you know, it's as an entrepreneur, you have to eat your own dog food and you need to know what it tastes like and you need to know how it works. And so and where the challenges are. And I would say that helped. Although there was a good, probably we built it in probably about 6 months, and then there's probably a good 6 month gap, just sharing it with other doctors, showing them what it was, before we had our first clients. I think they were in Wyoming that bought it, a husband and a wife. They bought it, and that was magical. Just to work so hard on something and then get it from kind of little P product to like big P product where you're actually selling it and supporting it and scaling it.
Very exciting. So you mentioned a few of the challenges and limitations that you faced in the process. What are the other ones? Like, do you have any other challenges and limitations you could share with us that it
Absolutely.
took to grow modernizing medicine?
As an entrepreneur, you get challenges every day. I can say, like, when we started the company, it was right after the subprime mortgage crisis. And so even though we were trying to raise money, we really couldn't. I think the first 40 venture capitalists were not really interested at all. There was about like 1,000 EMR vendors in the space, and they were like, "You guys are just a dime a dozen." They really couldn't see like how we were different, but our customers could, and I think that really kind of gave us a lot of reassurance. We remember pitching, like, I think to one of the VCs, and Dan had coded this like random like disease generator. And so like it would give random diagnoses to the patients. And we didn't like, this was just for the demo, not obviously for in production. And so basically it gave like a female patient like prostate cancer and all sorts of other things. And then like that, the venture capitalist was like, I'm not investing in this at all. So
Now that VC guy is kicking himself.
yeah, he should be, but it's definitely, it's I think that was a challenge. And so but we were able to raise like initial money from from physicians who saw it early on and really understood it, I think, and that was helpful. And then we had uh, a a British billionaire who like winters in Florida, who owned at one time like Reebok, but now owns like Lacoste, Speedo, and others, come in, saw it, like, and then invested. And I think that really gave us an opportunity there. In terms of other obstacles besides raising money, we live in Florida, so there's hurricanes, and so Florida's had its fair share of hurricanes, and so when that happens, we have to like send teams to other parts of the country so that we're up. What, you know, we always have support and access, and so I think that was definitely a wrinkle. COVID, as with everybody, definitely threw wrinkles in the operations. I think shortly after the government decided to shut down a lot of the economy, we had to build a telemedicine app and very quickly, so that our customers could have access. So we pulled one out, I think, in like 2 or 3 weeks. So that was a challenge, to build
Did
from
you
start
help
to.
code that one?
No, that was definitely on our team. Definitely on our that did it, and kudos to them for doing that. So I would say there's many of them. It's definitely just comes with running a business, and you just have to persevere and be persistent, to take every challenge and just instead and keep moving forward.
So you mentioned COVID and the use of a telemedicine platform. Have you seen an uptick in that use continue post COVID?
Yeah, you know, it's really interesting. I think it varies by specialty. I think each specialty has decided like how they want to use telemedicine. And so I've seen like a lot of our different specialties like urology and others use it as follow-up visits for people who like fly in for cancer treatment, and they still want to have that connection and just make sure their labs are okay. And I think it works really well for that. I've definitely used telemedicine myself for patients who were isolating at home, didn't feel comfortable coming in at the time of COVID. But I find that you have to like teach people like how to use a phone and how to like turn the flash on and where to
The
go. And so
camera.
like camera and like it's not
Yeah.
in focus, and can you pan down and can you pan up? And I think that part of it, I think for dermatology, ironically, is it's much easier to see a patient in person, because we do so many interventions. Like we can't liquid nitrogen through the telemedicine camera. We can't biopsy somebody. And so I think, it's definitely more efficient, I think, for derms to see people in person. But we do have store and forward capabilities for those that want it. And people use that. I would say in general, post-COVID, most people are just seeing patients in person. And I think they like that. But there are some that for patients that are far away, or that they can't get to the clinic, use it in certain areas.
Also, I would assume for particular conditions like acne or more melasma, rosacea, anything that's more
Absolutely.
routine and that doesn't really require an in-person intervention, it seems like it's very convenient.
Absolutely. And certainly if you have a lot of patients that are in college and then they need that refill of doxy, but they're coming back in the summer, like telemedicine is perfect for that. So it definitely has its place. And I think we're all learning in real time, like how to use the technology, really to help support us. So.
So, could you share how the platform has impacted the field of dermatology? Obviously, you were able to keep up to speed with, the times of pandemic and get online. Um, I always think about how you kind of like have syndicated information, and I'm sure it
Yeah.
has accelerated some research projects because all this data is in one place. Could you talk a little bit about that?
Yeah, I think it's like the little things and the little workflow challenges that derms have that we've just kind of created with our customers, what is needed. And so, obviously, like trying to remember a time like pre-EMA, pre-MR, like I think part of the biggest challenge of dermatology is how do we represent documentation using a diagram? And typically in residency, we would just like draw the little figure and then like, mark them with whatever we did to them, where the biopsy was or what have you, or where their distribution of their rash is. And I think the anatomical atlas that we did, I think was really helpful. A big impact there. There's tens of thousands of different anatomical zones. All of our customers, like you can imagine, the Mohs surgeons want even more granularity on the face, particularly, so they can absolutely pinpoint where that basal cell or that squamous cell was. So I think that was a lot of work, scaling and creating that zone, not just on the skin, but we actually did it for the human body itself, like bones underneath, muscles, growth plates, organs. So that's like a real different layers of the human body, and interacting in that way, I think was really cool. The way we do cancer logs, so how we track different skin cancers, was also something that we kind of figured out. In South Florida and Texas and California, there are lots of patients with 10s, 15, 16, 20 histories of skin cancers, and how do we document that in an accurate, efficient way? So I think that was really cool. The way we came up with a biopsy log and the results, like how do we create a data dictionary for the entire world to understand, so that when results come in, we can act on that in a way to reduce the documentation burden. I think that was really, really cool. The way we've automated ICD-10 was something that we solved. Our customers don't really need to know what ICD-10 is. They just put a diagnosis on a body, and that really helps figure out how to generate the code, so I think how we've allocated and collected quality measures. That was also something that we want to make sure wasn't adding a lot of pajama time to our customers. And so I think it never ends, as long as we stay true to whatever the challenges are, and listen to what the customers need. There will always be opportunities to improve it.
Yeah, I definitely think in terms of billing, in residency, you don't learn how to bill or about codes. So this kind of like it just makes it so easy, and it's like brainless
Yeah.
almost. So
Yeah.
that's,
You
I
want to
also
be
think,
focused on. Go ahead.
sorry, you want to focus on the patient. And so you don't want to be thinking, what code is this? So it's really almost like a breeze. I also have found that it takes away some of like the human error component, because I have seen this myself, where we did a biopsy on someone, and this was in a clinic I used to work at. And, human error, the assistant marked the spot, and then I guess the patient was having like two biopsies that day, and they marked the two spots and then sent the into pathology wherever those biopsies were taken from. And the pathologist called us and was like, "You marked the right shoulder and the left cheek." And I'm looking at the clinical photos to correlate it, and they're not like really aligning. And I think the one on the left cheek is really a basal cell, and the one on the arm or the shoulder is benign. I think there was like a little mix up. And that mix up was really like in the human component off of the Emma. And the Emma was like what saved us, and being like, "Oh yeah, that's right. That's where I marked it." So there's some, it kind of like helps you in the human error in the human error area.
Absolutely. I think that's technology at its best, to make sure that we're supporting the users of the system. And when I was in training, like we had a high resolution camera that was completely separate from the medical record, and just the ability to take a picture off the iPad within the application and tie it to the diagnosis is a big time saver and helpful for patient safety.
Yeah, and I remember a few years ago, I was working in a clinic and everyone was sharing the same iPhone to take pictures. Like you would have to run in, take a picture of the patient, and then run out and give the phone to someone else. So it's amazing that now you can just snap that picture on the iPad and put it into the patient's chart. So there's no mix up, there's no sharing of cameras, and it's safe and secure. I want to move on a little bit and just say, given the data that Modernizing Medicine has collected, could you shed some insight into how frequently individuals in the US visit a dermatologist in comparison to other specialties? And how does dermatology stand in terms of claims data versus other subspecialties in medicine?
Yeah, so we have a whole data platform that we really just service our customers, and so they have the analytics where they can kind of see, where they stand, what their biopsy hit rate is for like when they do a biopsy. Is it how often is it precancerous or cancerous, things of that nature. Features for them. We haven't so much done cross specialty analysis, but we definitely want to make sure that practices themselves have access to their data and can use it for operating their practice, I would say.
Okay.
In
And
terms of like, yeah, go ahead.
no, no, continue.
Yeah, in terms of like other areas, I think like in terms of impact on patient care, patient education, things of that nature. We talked a little bit about that high resolution photo in terms of patient safety, I think is really important. The system itself creates education handouts simultaneously with the workflow. So I think it's super helpful for patients who can now obviously log into their portal and see what the doctors said. Sometimes our visits are really quick and we don't want anything to get lost.
Mhm.
Also, with the 21st Century Cures Act, having the ability for patients to access their results in a timely manner and kind of facilitating that feels really good as well. Because being on the receiving end of a patient, you always want to get that information yourself to kind of review it. So I think that really helps there. And then from a value-based care perspective, I think, having a way of collecting those quality measures without double documenting or documenting in two systems has been really, really helpful there.
Mhm.
I haven't really seen as much focus on value-based healthcare in the specialties and the surgical specialties, but they're probably coming and having
As well as
certain quality
dermatology,
measures.
not so much.
Yeah, not so much in the dermatology world, but it's starting to come in the relations to prior auth and things of that nature, looking at like total body surface areas for psoriasis or eczema when you're trying to get prior
Get a
authorization for a
biologic.
biologic. And so I think, we put those in several years ago, and I think that's been helpful for our derms and their patients in terms of documenting the coverage they need to get the right treatment.
Right, definitely. Because I've seen a lot of like prior authorizations get rejected because someone forgot to put in the body surface area. So it's really important. Um, and what do you think sets Emma or Modernizing Medicine apart from other EMRs? Because as you know, there are so many out there, but Emma is definitely favored by a majority of dermatologists. And I'm just curious, like, what is your competitive edge and what drives people and clinicians to use your platform?
I would say it's a whole team. We have a great dedicated team from customer support, and a lot of those people that are supporting our practices came from practices, so they understand the clinical environment. We have office managers that support the PM side. We have former medical assistants that are educators. I think that helps. We have physicians on staff, so we have a team of dermatologists that practice, use the product, but also talk to other doctors about what enhancements there are. So I'd say a big differentiator is our medical knowledge base. We have millions and millions of lines of code of dermatology knowledge, and we have dermatologists who can code it. So if there's a new laser that comes out, or if there's a new procedure or technique, you can have that doctor-to-doctor conversation about it, which I think really makes us unique. I think there may be other vendors that have physicians as consultants, but they kind of just advise, whereas here they're really integral part of the dev process, which I think is really different from everyone else. I think the specialty specific focus is probably what makes us most different from all the other vendors that are out there.
Okay. And with the growing interest in artificial intelligence, I'm sure you've gotten this question before, in healthcare, how do you see modernizing medicine integrating AI into its platform?
Yeah, and I think there's a lot of hype and excitement about artificial intelligence. And I think, we have to kind of separate the hype from what's really going to help support doctors and patients. And right now, I think that the biggest area to focus on is, I think a couple areas. There's physician burnout, there's staff turnover, there's labor shortages, there's hyperinflation. And so we have to do more with less, which puts a burden on the staff that we do have. And so I would say, focusing on the non-healthcare delivery aspects of AI is where we should focus. And if you think about that, there's like 4 trillion healthcare dollars spent in the US. 25% of that is focused on administrative burden. And of that, there's about $205 billion that are focused on physician offices, admin. So the operational costs of running a practice, but also billing support, scribes, workflow intake, how do we collect messages from patients and things of that nature. And I'll call that the drudgery of healthcare, the challenges of, operating a practice. Nothing to do with delivering care. And so I'd say if we can automate a lot of the drudgery of healthcare, and saving time for doctors and patients, I think that could be super helpful. And there's tremendous staff turnover right now with hyperinflation, with post-pandemic burnout, where, the average, medical scribe, the turnover rate could be between 30 and 50%. So practices need some stability. And if somebody leaves and we can't find somebody else, how do I run my business? How do I get, help there? And so those are kind of the areas we're really interested in helping and supporting our customers, because that's really the next level of challenge they're facing.
And what do you think is the most unique feature or functionality about modernizing medicine or Emma specifically?
Yeah, so I can't go into specifics yet about like how we're going to use AI, but I'll say at a high level, we'll be announcing plans for AI initiatives around helping with the labor shortage, physician burnout, staff turnover, that will hopefully resonate with our customers facing real big challenges operating in the hyperinflationary period that we're in. Because as you know, doctors don't get reimbursed accordance with inflation. I know that there's some work with Congress to try to fix that, but right now we're having to work harder just to make the same amount of money. And so for me, to support the customers, for our team here at Modernizing Medicine, how do we innovate in a way that you can automate some of the things to reduce some of the expense that practices are facing. So maybe they don't have to see more patients to make the same amount that they were making. And I think that's technology at its best. So that's what we aspire to do. And you'll be hearing more about that in the coming months.
Very exciting. And that also maybe plays a role in with value-based care as well. So
Absolutely.
sounds like
Absolutely.
there's a lot to look forward to, Dr. Sherling, and I thank you so much for your time today. I enjoyed hearing the backstory of this really incredible and impactful EMR system that I rely on every day. So thank you for your efforts and for making this possible. And I hope everyone enjoyed this episode of the Derm Club podcast, and we will see you again soon on the next episode.
Thank you for your time.
Thank you, Dr. Sherling. I hope you enjoyed this episode of the Derm Club podcast. If you found the discussion today to be valuable, please subscribe and share. I look forward to seeing you in the next episode as we continue to delve into dermatology and skincare with the world experts.